Hi, everyone. Thank you for joining today's webinar on advancing stepping up for youth in Kansas. My name is Felicia, and I'm from the Council of State Governments Justice Center. I will be facilitating today's webinar in partnership with my colleague, Audra Goldsmith, who you'll hear from in a bit. Next slide, please. So here's an overview of our agenda for today. We're going to do just brief introductions, but mostly you'll hear about all about Kansas Stepping Up for Youth initiative and the evolution of that. You'll learn about how we piloted the initiative and also how you can leverage the Stepping Up for Youth Technical Assistance Center for your goals. And we'll also have time for questions and answers before wrapping up. I just want to go over some quick housekeeping items. Anytime during the webinar, you can ask a question by clicking on the Q&A button at the bottom of the screen and entering your question, and we'll try to keep track of that as we go and respond to some in there, and maybe some we'll hold for the Q&A portion. If you look at the chat, you'll see guidance on there about how to address any technical or audio issues that you're having. But we are recording this webinar, and we'll post it along with the PowerPoint slides either on our website, or we'll follow up with an email within a couple of days. So just give us some time for it to load, but we can send that over to you as well after. So that's my quick intro and hello. I want to pass it over to Clay McCarter from Kansas Department of Corrections, who will share a few remarks.
Hi, good afternoon, everybody. I just wanted to start by saying thank you to everyone for being here today. I know that everybody has a full schedule, and so I appreciate everyone taking the time to join. This work is important, and I just appreciate everybody just making this a priority. More importantly, I just want to thank everybody for the work that you do every day. We work to improve outcomes for kids and their families, especially those kids that are dealing with behavioral health needs and those kids that come into contact with the juvenile justice system. So whether you're working with behavioral health, juvenile justice, child welfare, education, county government, or other partners, this work matters, and we're just grateful for your commitment to be here today. I'd also like to recognize our partners with KDADS and our partners with DCF. We appreciate their partnership and their commitment to supporting Kansas youth and families. So one thing that we know is that no single agency can solve the issues and the challenges that we deal with. Some of the challenges that we'll talk about today. Helping kids, helping young people with these complex issues requires all of us to work together. We've seen some of the, I guess, the repercussions of trying to tackle some of these issues on our own. So that's why we're partnering with these different agencies and partnering with you guys and all these people that are represented in the room today. That's why it's so important. We also want to recognize the leadership that's happening at the county level, the local level. While the state agencies can provide support and resources and guidance, the real change happens in our local communities. It's those county leaders, the local providers, the schools, the courts, law enforcement, the community organizations. It's all of them working together every day to meet the needs of those youth and those families. We know that collaboration isn't always the easiest. It's a real challenge sometimes, and every system has different responsibilities and priorities, and sometimes even different ways of approaching the same problem. Many of you are already involved in multiple initiatives and trying to coordinate across organizations, and that can be challenging. But it's also where there's a lot of opportunity. When we communicate and when we share information and we work toward common goals, we create better outcomes, not only for our systems, but really for the young people and the families that we're here to serve. So that's really exactly why KDOC is proud that we get to support the Stepping Up for Youth Technical Assistance Center. We found that our goals are really closely aligned. We all want to reduce unnecessary involvement in the juvenile justice system. We want to improve access to behavioral health services. And we want to make sure that communities are using their resources as effectively as possible. So supporting the Technical Assistance Center is just one way that we can help strengthen community-based responses while encouraging better coordination between those state and local partners. So the Council of State Governments Justice Center partnered with 7 of our Kansas counties, Barton, Bourbon, Franklin, Johnson, Sedgwick, Seward, and Shawnee, to pilot the Stepping Up for Youth framework. So those counties help shape what this Technical Assistance Center has become and what you guys will hear about today. They tested ideas and shared challenges and identified what was actually working at their level. And so across all 7 counties, there was several themes that continued to emerge. Strong cross-system collaboration really mattered. Using data to guide decisions mattered, and having practical tools that could be adapted to meet their local needs mattered. So those lessons really became the foundation for the Technical Assistance Center that you'll be learning about today. It's designed to be practical, to be flexible, to be responsive to the needs of Kansas communities, because it was built with the help of Kansas communities. So as we get started today, I just encourage each of you to think about how your county can take advantage of this resource. The Technical Assistance Center is available at no cost to you. It's here to support the work that you're doing. It's here to support and not replace. So at the end of the day, this isn't about launching another program. It's about building stronger partnerships or improving coordination or creating systems that better serve youth and families, or all of the above. The state of Kansas is committed to supporting that work, but lasting change happens locally. It happens because people like you all are willing to come together and build those relationships, find better ways to serve youth and their families. So I just want to say thank you for being here today. I'm excited about what we can accomplish as partners. And I hope that you all will take full advantage of everything that the Stepping Up for Youth Technical Assistance Center has to offer. And so I'm going to turn it over to Audra, who is the Technical Assistance Center, and let her take it from here.
Thank you so much, Clay. And apologies in advance. My camera was working and now it's not. So you guys just get to hear my voice today, which is probably better than seeing my face. But thank you all for joining. Clay, thank you for the kind words. We continue to be excited about not only your partnership, but obviously the advancements of this initiative across Kansas. So I'm going to take a little bit of time and just give some background on the initiative, the work that we have done from 2023 through 2026. If you will advance the next slide. Thank you. So how did this TA Center and this new kind of endeavor of Stepping Up for Youth come about? It really came on building on the success and the momentum of the current adult-focused, if you will, Kansas Stepping Up TA Center. There was a lot of interest in seeing the collective kind of desire of bettering the justice system, not only for adults, but also for our youth in the state. And at a county level, we were frequently asked, when can we adapt the current framework of Stepping Up with a youth lens? And we really felt like there was strong potential to do this and uplift this sort of task right here in Kansas. And so we approached KDOC about the potential opportunity. They were very excited and decided to partner with us on starting the Kansas Stepping Up for Youth Technical Assistance Center. It is the first in the nation to obviously even take on the endeavor of the youth initiative and also to launch a technical assistance center focused on serving youth. Clay already shouted out, but again, just a big thank you and want recognition to the partners alongside of KDOC who have been there to support and to help provide guidance and feedback as we have built and established and started this initiative here. So thank you to KDADS and DCF for your continued work on this particular project. It really does take a village. It takes all of us to collaborate together, both at a county and a state level, to start to rise over the challenge that we do see for our youth in the state as they experience both behavioral health issues and the justice system. Next slide, please. All right. I think that is a little bit why this initiative is so unique. We are working at both the state and local level and have since we started this project back in 2023. We felt like that would really have the best impact on starting a new initiative, but also really moving and advancing Kansas's efforts on building a stronger infrastructure when it comes to youth with behavioral health needs who experience the justice system. So when we talk about our state efforts, we really looked at removing barriers and strengthening systems at a state level that we could really focus on that cross-system coordination among our state agencies, looking at ways to align policies, align funding and operational practices, specifically with the three kind of partners of this, if you will, but also among other state agencies that also have a role in those types of practices at a state level. And then at a local level, something we really wanted to look at is implementing change in the communities. So we wanted to focus on adapting that Stepping Up for Youth model to where it really spoke to the needs of the juvenile justice system and communities. And we were really hoping to walk away with this type of new initiative with having key performance data matrix, things that we could actually measure to show progress and have accountability and show hopefully positive outcomes in our communities. And use that information to help counties look at ways that they can better their systems and make program and service advancements in their own localities. And hopefully doing all of that by leveraging the Stepping Up for Youth Technical Assistance Center, which we'll talk more about here in a few minutes. Next slide, please. You can advance some more. All righty. So just a little breakdown and a timeline of how this work kind of unfolded. That year one, we really looked at, building the infrastructure. So we gathered a state task force and had various convenings on information gathering and really sort of the system analysis of how does a youth experience the justice system when there is a behavioral health concern that they are living with, and taking that walk through at a state level, what's available, where our gaps are, and really looking at funding mechanisms across each of those intercepts, and what data is available across each of these intercepts, and taking a fine look at those things and figuring out ways that we could fill those gaps and have some recommendations on those. There were various focus groups, and we will touch on that here in a minute as well. And we also had a county level focus group that we started to talk about what do we need in a Stepping Up for Youth framework to make this initiative impactful and really useful at a county level. And that kind of got us into our second year of this planning and implementation. We formed a very kind of short-lived but very productive Stepping Up for Youth work group where we built and put together the key components of the new framework. And once we feel like we had that in a good place, we then took that framework and built it out more internally until we were able to launch the Stepping Up for Youth pilot site work that came kind of in the midst of 2024 to 2025. And then at a state level, We took all of that analysis and system review that we did during year one, and we formulated some statewide findings and recommendations. And so in year two, we presented on those recommendations to various state committees and groups, got feedback on them, started to talk about action planning for those specific recommendations. What would this really look like if we were going to put this in motion at a state level and coordinate across policies, funding streams, those types of things? How do we actually make this come to light? So we had various meetings with our state task force and different committees on getting some feedback and ideas on really mobilizing those recommendations in the state. And then the last third year of this project was really focused on that expansion, sustainability, and progress. Talking about strategic sustainability of doing things like today, right? Letting Kansas know this resource is here, letting folks know what they can get when they leverage the Stepping Up for Youth framework, and really just starting to promote data collection, system analysis, and ways that counties can tap and use the resources such as peer connections as we broaden this initiative across the state. Next slide, please. Thanks. So as I mentioned, during the course of this kind of 3-year project, we examined different intercepts, if you will, or different touch points a youth may experience through the justice system, as well as having, a behavioral health need. So we went and looked at different processes, services, programs across all of these intercepts that you see here on the screen. As I mentioned, we didn't just look at what programs they provided, but we also tried to look at what data they collected, and started to get some information on how that might be shared across this system with all of these different stakeholders. We had various listening sessions to get more information from judges, behavioral health providers, school, law enforcement, child welfare, folks with lived experience, and the like, to really try to get a full picture of the juvenile justice system and the behavioral health intersection. Next slide, please. And so in that, these are really the recommendations that we came out with during that first year of work. This first recommendation on developing an early intervention system for youth, we really wanted to look at reducing the inappropriate involvement within the justice system and the child welfare system, and really promote a more effective and coordinated use of state funding. So strengthening that cross-system coordination, scaling and strengthening both existing and new community-based interventions statewide, really leveraging and maximizing the use of Medicaid and other existing state funding sources, and then really addressing any sort of gaps in provider capacity or some public agency capacity, and even talking a few things about workforce. So those were some different focus areas of kind of this first recommendation. And then the second recommendation, we really wanted to look at strengthening the appropriate use of detention and really improving the use of research-based assessments, services, behavioral health management strategies, and reentry practices. We discussed a lot about establishing statewide supports for those things, developing some detention best practice standards, really encouraging the JDCs to participate in some performance-based standards. And then that's where a lot of our conversation on leveraging and maximizing the use of Medicaid also started to come into play, and strengthening the reentry planning and services for youth. And then we also had a few discrete recommendations that came out of our analysis and various focus groups. We talked a lot about MHIT at the time. We also talked about standardizing some immediate intervention plans across the state in partnership with OJ and KDOC. We talked about developing some behavioral health specialized caseloads for youth, and also requiring some case coordination meetings for providers and partners that were serving youth and youth at risk of being committed to KJCC. So these were just some additional discrete recommendations that came from that landscape analysis. And if you will go to the next slide, please. Are you able to go to the next slide, please? Thanks. All right. So at a local level, what we were really focusing on at the time is within that first year of work, as I mentioned, we formed that Stepping Up for Youth work group. We really wanted to say, if you had a new framework, what are the bare bones, the meat and potatoes, if you will, that we need in there to really be something beneficial for a county to pick up, leverage, and really have positive outcomes in their community. We wanted to make sure that there were shared goals in there and definitions for the initiative and things like that. We started to have initial discussions on data and what data matrix would be appropriate for this particular initiative to have counties collect that really could inform their long-term or short-term strategic planning goals. We also supported the state task force. So as we were getting feedback and conversation on forming this framework in our own work group, we were providing that context and getting a lot of feedback from the state task force just to make sure that we were aligning goals and priorities, and then also did various presentations on the idea and the concept of the new framework to other state committees, again, to just reinforce and get feedback on is this going to be a useful framework, or is there something that we're really missing? And then really in our last year of this particular project on forming the framework, we piloted it, as Felicia and Clay have both alluded to, with our 7 pilot sites, really breaking it down into modules of the framework, which I know Felicia will discuss here in a little bit, and giving them time to not only work through it within their own cohorts, is what we called them, but also allowing them to give us feedback on ways to better the framework or additions or resources that may be needed so counties can successfully walk through that framework as they pick it up and put use to it. Next slide, please. Thanks. All right, you can go to the next slide. So we're going to review the framework a little bit here. So we know the issues. I mean, surely most folks on this call work at the intersection of behavioral health and the justice system in some shape, form, or capacity. So we know that there's a lack of upstream prevention, right? We know that there's varying services across the state, specifically if you're living in more of a rural frontier versus an urban area. We know there is a lack of really robust crisis systems, crisis response systems geared specifically towards youth. And as we all know, there tends to be large silos when it comes to different agencies and organizations and services that work with youth, and they function very independently instead of collaboratively. So we took all of these issues, none that are new or unknown, but we really said, what do we need as a roadmap then to help counties really start moving the needle? And so next slide, please. We came up with this overarching goal. We want this framework to be able to strengthen infrastructure. We want counties to be able to walk through this framework and look at utilization and availability of their current resources, and think about ways to make that improvement in their communities so that they have safer communities, so that they have increased both accessibility as well as prevalence of services that really make a positive impact for youth and helping them essentially divert from detention, right? Going anywhere to close to secure detention. Hopefully, they can divert as early in the system as possible. So, this is the goal of the framework. And next slide, please. And when we met with our Stepping Up for Youth kind of work group in the very early stages, this was a little bit of just the structure that we wanted to set up. We wanted to have guiding principles. So we wanted to make sure that there were ground setting areas of focus, that when you meet as a collaborative, you understand why you're meeting. You can understand the goals of meeting and really form successful and sustaining collaboratives in your communities. We wanted to be able to provide essential questions to guide this work. So what do? We meet, we're around a table, we know this issue is here, but now what? So hopefully the questions that we developed in the framework are those guiding roadmap questions, right? They help guide the work, they help move progress in your community and your discussions as a collaborative. And then really this last bucket are what is the data telling you and what data indicators do you specifically need to help tell this story so you can decide on the most appropriate and impactful programs, services, and policy changes that you might need in your community to really start having a positive impact and having good outcomes. Next slide, please. All right. So these are the guiding principles that we adapted for the framework. Some of them did come from a resource with the Juvenile Justice Leadership Network, which is linked here as well as in the framework document itself. But as we talked as a group, we also decided that it was essential to add in a couple of different guiding principles. So a few unique ones here were really looking at law enforcement. We wanted to make sure that looking at interventions beyond just law enforcement was a guiding principle of the framework. We also wanted to make sure that we were looking at early prevention and intervention solutions, policies, and programs that could help guide this work. So those were two additional guiding principles that we kind of baked into the foundation of this framework. Next slide, please. All right. And so when I talked about kind of the guiding questions of the framework, these are the 4 guiding questions that we came up with. And I will quickly kind of walk through each of them in the next slide. Thank you. All right, so that question 1 is really, do we have consensus? It talks a lot about identifying your core team. So who in your community champions this work? If you're going to talk about improving behavioral health in the justice system, who would you need in your community around the table to help with those policy decisions, funding conversations, and program implementation strategies, right? And then really talking about mission and vision, and making sure that you are defining roles and responsibilities and establishing goals for your initiative. The second question is about really aligning your systems, doing a system review. What do you have available in your community when it comes to programs and services that can be kind of wrapped around, accessed and utilized by youth who experience the justice system? So taking a deep dive into that, developing a map, if you will, so that you can start understanding where there are gaps in services in your community. That third question is doing the same thing almost, but with data. What data do you have in your community? What types of mechanisms do you already have established for information sharing? And also, again, that sheds light on where those gaps are in information sharing processes, but also in just data matrix that maybe aren't captured anywhere that could be very useful for your stepping up youth stepping up for youth efforts and any sort of data decision making or strategic planning. And then the last question is really monitoring progress. We want to make sure, and counties want to make sure, that as you guys put forth the effort to better your systems, is it working? Is the system, the service, the program, the policy change that you have implemented or enhanced, is it working? We don't want to put our time, talent, and treasures into something that is not going to target the population we want and that is not going to have the kind of impact that we thought it was going to have. So it's always good for and making sure those things are having a positive impact. And this question is also about reviewing who's around at the table, right? Making sure that you're not missing somebody, making sure that there isn't a new initiative that needs to be folded into the mix or just informed of the work that you do. So it's all about kind of going back, looking at things continuously, reviewing and refining your practices as you do this work. All right, next slide, please. And I'm going to pass it to my colleague, Felicia.
Thanks, Audra. So we've been talking a lot about the pilot sites. We're alluding to it during our time so far. So I'm going to share a little bit more about what we did with the pilot sites in Kansas. So last year, we piloted the Stepping Up for Youth initiative with the 7 counties, Barton, Bourbon, Franklin, Johnson, Sedgwick, Seward, and Shawnee. I posted in the chat a link to the article that we wrote to summarize our work if you want to check it out more. But they worked very closely with us, and we're gracious to them because we did put them through the ringer, if you will, with those 4 key questions, and also the frequent meetings and activities. But they did such great work, so we're really proud of them. But we provided them the support through the framework and the activities to really firm up their data analysis as well. Like Audra was talking about the policies and practices, seeing what's missing, what's working well, and kind of like constantly reevaluating all of that, looking at who's missing from the table, right, in these discussions, and how they can improve their work in the core team for their Stepping Up for Youth initiative. So we helped through all those processes, help them with that more like precise planning and reducing those silos. Again, we want to, through Stepping Up for Youth initiative, help counties in Kansas create more coordinated pathways for care for youth with behavioral health needs, like Audra was saying, even before they reach detention, right? So we don't want to silo this out to just detention. We want to really look at this as the entire continuum of care for youth, overlaying that with the juvenile justice system as well. So through that pilot site activity for over the past year, the counties gained a clearer insight into where the things were going well and were working, where there were gaps to continue improving on, and what was needed to sustain the change that they were already working on for youth in their communities. Next slide, please. So I'm going to share a bit more about what they worked on, and Audra, and you'll see this like overlays really well with those key questions that Audra just talked about. So all of our, we worked them, and you can see the timeline below each of these sections here. But they worked through this structured improvement process using that Stepping Up for Youth framework that was like really in draft mode at that point. So like Audra talked about, we used the pilot phase to also inform the framework and make sure that it was relevant, that it was usable, and that that counties really felt that value from the framework. So we really appreciate and value their feedback, and we're able to like continuously improve that as well. So first, the sites focused on building buy-in and consensus by convening local cohorts in their counties, identifying project coordinators, conducting outreach, and doing any engagement activities needed to like bring this council together to develop a shared mission and clarify goals and responsibilities across those partners, and like really create those accountability mechanisms. Next, the counties then worked on assessing their systems through that map that Audra talked about earlier, analyzing what's happening right now, what processes, practices, services that are available, just mapping everything that exists. And comparing that to what does best practices say, and then that illuminated areas for improvement. After that, they strengthened and worked a lot on data, this is where we really put them through the ringers, but they were phenomenal with engaging in this practice of mapping out all of the data that exists regarding juvenile justice and youth with behavioral health needs, screening and assessment, connections to care, data sharing, tracking priorities, and then aligning all of that with what they want to do for their system improvement goals, and using that to then say, oh, we're actually missing some data here. Like, who has that data? Let's talk to them. Let's bring them in. And then finally, the pilot sites work on monitoring and adapting their work. So they're still working on this, right? This is like something that happens over time continuously. And we look at this framework as like kind of like the infinity loop. Like you just kind of you start where you are and you just keep going through the key questions and the framework, and you come right back around as you continue prioritizing processes, policies, and practices to help advance the goals, and to intentionally implement priorities that are identified, and using data to then review the progress on that. Is that working or not? And to refine strategies. And again, support that continuous improvement. So all the activities like help the pilot sites, again, build that stronger cross-sector collaboration, gain a clear understanding of their local system and what exists, right? So some of them were pleasantly surprised to find out services that they had no idea about before working through this framework. Improving data-informed decision-making and creating a foundation for that sustainable systems change, which we know takes a lot of time. Next slide, please. So this is what the counties shared, the pilots shared, that was really helpful as part of participating in the pilot and the initiative for Stepping Up for Youth. They reported that stronger cross-system collaboration with schools, corrections, courts, law enforcement, child welfare, behavioral health providers, community organizations, to develop those strong partnerships and work together to be more effective in supporting youth in the community that have behavioral health needs and are coming into contact with the system. They also value the TA that we provided, the technical assistance and expert guidance provided through this pilot. Again, having that structured framework to work on and activities. We also provided, in addition to the cohort-based learning, individualized support to each of the 7 counties. We provided them access to specific tools and resources to help them move, again, from that planning to action and implementation. Another benefit was improved behavioral health response for youth. So they were better able to identify the needs earlier for youth, connect them to appropriate services, reduce unnecessary involvement in detention for some youth, and again, expand the use of those community-based supports that exist locally. They also strengthen their data-driven decision-making and continuous quality improvement efforts. So building that data capacity, examining local trends, and identifying service gaps to help develop solutions. Instead of like just going based on assumptions and what they think is not there or is a gap, they worked in a data-driven manner. They also were able to be part of that broader learning community. So having that peer network of other counties, learning from each other, sharing what's working, what's not, and collaborating really helped. And they also noticed that participation helps to elevate their leadership profile, right? Some of the counties, as you saw in the earlier slide, became innovators, meaning like they're looked at as a county that has really strong data and reporting on metrics related to youth and behavioral health and juvenile justice. And they've also been recognized as early adopters. Again, like we talked about earlier, Kansas is the first state in the nation to launch not only Stepping Up for Youth TA Center, but this initiative specifically and the framework, right? Like piloting this in Kansas is pretty innovative. So they were able to be part of that. So we can go to the next slide. So you're talking a lot about the TA Center. Next slide. So I'm going to share more about what it is, what it offers, how you can use it to better support your outcomes and for youth with behavioral health needs in your community. And again, reap those similar benefits like we just shared about. We want you to be like them and just create this movement in Kansas. So what is a Stepping Up TA Center? So a Stepping Up TA Center provides tailored and individualized support to help counties improve outcome for people with behavioral health needs that are involved in the justice system or at risk for involvement as well. So counties receive guidance on using data to inform policies, practices, and decision-making. Again, we're very, very data-driven. We don't want to work on assumptions. TA Center also helps communities identify behavioral health needs and then connect people to appropriate services and supports. Our technical assistance is very centered on helping build local capacity to collect, analyze, and use key data indicators. So we really hold your hand through that to get you there and really reduce that the fear around data that sometimes exists. And we also help strengthen that collaboration between justice, behavioral health, healthcare, child welfare, community partners, et cetera. So overall, the goal of the Stepping Up TA Centers is we want to reduce unnecessary incarceration. We want to catch people earlier in the system to improve access to treatment and support and really divert them away from the system as much as possible. So if it wasn't clear already, we operate both the Stepping Up TA Center in Kansas and the Stepping Up for Youth TA Center in Kansas. So Audra and I are tag teaming this. We're working together to have this coordinated approach for you so you can benefit from that and also create opportunities to align any efforts and strengthen behavioral health responses again across that entire continuum of care for youth and adults in Kansas. So we're really excited to be able to provide this support. Next slide, please. So this is what you can expect when you engage with us with the Stepping Up for Youth TA Center. You'll receive support from either Audra or myself, or also other identified staff at CSG Justice Center with different expertise that will serve as a consistent point of contact. So either Audra or myself will be in contact with you, and we are very committed to that. So you won't fall through the cracks. In addition to that consistent point of contact, you'll get individualized technical assistance, so one-on-one. And you can gain access then to a whole host of peers that are working towards similar goals in your state. So it's always great to break down those silos and feel like you're part of this network, right, of other people committed to the similar goals of supporting youth with behavioral health needs. And that helps create opportunities for shared learning and problem solving and, again, building local capacity. We want to really leverage your local strengths and not come in and tell you to create a whole new system, right? We want to leverage what exists. When you participate with the Stepping Up for Youth TA Center and engage with us, you can benefit from access to experts on specific subject matter expertise. We have resources that we can share with you, provide you guidance with those resources and other strategies that lead to that lasting systems change. And the TA Center is operating as well to strengthen communication between county and state leaders. Audra mentioned this earlier in the webinar today about we're really like in Kansas focused on state and local and like really creating that feedback loop and making sure that local experiences help inform those broader policy reform efforts and resource allocation decisions, et cetera. So that's what you can expect and probably more, right? But those are the key benefits of the Stepping Up for Youth TA Center that you can expect. And then on the next slide, we have future engagement opportunities that you can expect from us. If you're signed up to our newsletter, or if Audra has your email and you get email blasts from us, but you can expect to hear more about more webinars in the near future. Peer learning opportunities. We actually have the next one on July 21st at 12 p.m. Central Time. I'm going to try to share the link in the chat to how to register for the entire series, because we're going to be meeting quarterly actually to do those peer connection hours. So this link that I just posted in the chat allows you to register for all of them. So hopefully we'll see you on one of them. And we'll also be, like we shared, launching the TA Center, right, and continuing to promote that. So we'll be running that. And then continuing that state and county alignment effort. Like we're really committed to that as well. So that's what you can expect for future engagement opportunities. And if anything else comes up, again, we'll be communicating with you very intentionally from here on out. So next slide, please. So, this is cool. So we are expanding the Stepping Up for Youth TA Center, expanding across Kansas. Like, how are we doing this? So again, we're inviting counties to sign up on as a Stepping Up for Youth county, providing webinars such as these to share about the Stepping Up for Youth TA Center and other topics that arise and other efforts that we can provide through webinars, promoting the initiative and the framework that we're using to guide this initiative. We want to continue, and we're continuing that partnership between KDOC and KDAD. So very grateful to them for their support. And we are still communicating with the Stepping Up for Youth pilot site. So we are continuing that TA with them and following up with them and being their coach throughout this process. So that's how we're expanding. Those are our efforts and our plans. Again, want to reiterate the excitement, the enthusiasm that we have. We're ready. We're open for business. So if you all want to check out the links that we shared in the chat, I think we also Audra just shared the link to actually request support from the Stepping Up for Youth TA Center. Please engage with us. We're here. Like Clay said, this is completely free to you. There is no payment needed. So please take advantage of the support that we can provide. And we're also happy to just, like, even if you're not sure what you want to do yet regarding youth with behavioral health needs, like, we're here to even help with that those pre-planning and brainstorming discussions too. So that's about it for our presentation. We're going to be shifting over now into Q&A. So not sure if there's anything that's come in through Q&A, but if anyone wants to share their questions there or in the chat, we're kind of looking at both.
I'm going to throw a question in the chat if folks want to put a response in there, if I can get back to my chat. But I'm happy to just hear thoughts on what do you feel like would really motivate your county leadership to want to do an initiative like this in your communities? Whether it be a challenge or a barrier that you know really exists in your community, or kind of a themed service or program that you have always wanted to implement, but just haven't really gotten there to do that, maybe because of a need of a collaborative effort. But what do you feel like would really motivate county leadership to start an initiative like this? Maybe these can be more food for thought questions if folks don't have a lot of feedback right now. But oh, thanks, Pam. Um, no. Yeah. So Pam's question, would we able to know who attended and what counties are represented? She's a representative from DCF and would love connecting and just having some conversation and knowing their thoughts and interests. I'm happy to, we can probably compile like jurisdictions and counties that attended. Pam, if you're able to share kind of the catchment area, if you will, that you represent or work with most often, we can definitely make some connection emails so that we can help you foster kind of that local interest in your areas. Absolutely. Yeah, thanks, Max. I saw your comment in the chat. You're an active member of the CJAB, and they haven't heard of Stepping Up. So absolutely, if you guys are a part of, and that kind of goes back to my second kind of prompting question that I threw in the chat of, what types of current councils, partnerships do you already have in your communities that you could see this type of initiative complementing, right? It's not here to replace anything that you already have going on. The initiative and the framework is really here to be that roadmap to help enhance and advance those efforts. So we would absolutely be willing to present to any local CJAB at all, and have conversations of leveraging the framework within those, those committees and ways that we can help advance the stepping up efforts in those jurisdictions. And we'll note your information there, Pam. Thank you. All right. So I think just another kind of food for thought of, taking this back to your own counties and agencies even, is thinking about who you have in your community that really champions this work. There might be somebody within let's just say your local DCF, that you know is a very good advocate for bettering systems, and really does have a passion for having these collaborative conversations with different community partners. So that might be a person to reach out to and say, hey, I attended this webinar. We talked about stepping up for youth. I think it could be something that we could leverage together and start kind of that recruitment process of who are the folks in your community that could really champion growing this effort in your community, and making, that kind of formal stance that you want to be recognized and sign on as the Stepping Up for Youth County. So start identifying who your local champions are. And then start identifying maybe what already exists as far as any sort of, mental health task force or councils or any sort of group that has conversations or has objectives that really work towards behavioral health and the justice system specifically for youth. Because those would really be your starting areas of having conversations and doing some outreach, if you do have an interest in wanting to become a Stepping Up for Youth County. As I kind of commented before, if you have those agencies or just other partners in your community that weren't here today, that you would like to meet, individually with Felicia and I and start having conversations of how do we get this started here. I did throw our email in the chat. And it is here on the screen as well if you want to note it. There is that form. The link was in the chat as well. You can fill that out as a means of outreach, but we're happy to meet individually and just really talk next steps, give you some guidance on how you would get this started in your own community and who you would need to really have around the table to help drive these efforts. I'm not seeing any other questions or anything in the chat.
I wanted to pose
Yeah.
one more question, like if anyone
Sure.
has any questions or about the TA Center, Stepping Up for Youth TA Center, or if there's any of the benefits that you really are resonating with that you're looking forward to leveraging. If anyone wants to share about that in the chat before we wrap up, we'd love to know.
Mhm. And I just want to address Ryan's question in the chat about the Stepping Up for Youth initiative complementing or conflicting with the SB 2329. And Clay, please feel free to jump in at all if you would like. But, as we have talked about the framework and we have talked about really one of the bread and butters of Stepping Up is having collaborative efforts. And we know anybody who's been following the SB 2329 and is starting to understand the implications of the news of the system, right? Those conversations can be had within your Stepping Up for Youth Council. Although you might not have a magic wand or a perfect solution or all the money in the world to address some of the things that might result in these new changes in our state. Having that collaborative body to have those conversations, to be innovative, to come up with strategies that might not fix it perfectly, but might have a good impact is really what stepping up for youth is about. And so we would encourage within folks who do have Stepping Up for Youth councils or any mental health and criminal justice council, that those conversations are being had there, and not just about the challenges and the barriers that we face in our communities, but that is where you talk about the innovation, and the services and programs that you can potentially try to enhance and uplift to have a better impact on finding solutions and have a better impact on the barriers that you're experiencing. Clay, I don't know if you have any feedback or any comments on Ryan's question, but it definitely is there to complement, not to conflict.
Yeah, I mean, so I would share, I guess a few thoughts. So I guess in theory or in approach, there is some conflicting thoughts, opinions, or even approaches to the system in general. Um, uh, the Department of Corrections opposed House Bill 2329 for lots of reasons. But when we look at stepping up, the belief is that there's a lot of youth, and even when you look at the adult system, we crafted stepping up to fit into the youth system because of the work that was going on in the adult system. If you look at either system, there's the tendency for just I'll just say people in general with behavioral health issues, mental health concerns to get pushed into the system to receive services. 2329 is requiring for a lot of youth to get pushed further into the system because of this two strikes rule, where we have two intake events within a 30 I'm sorry, I was going to say 30-day, within a 3-month period that are getting essentially mandatorily overridden into detention. So I think as we get further, obviously, we're only 9 days into implementation of 2329, so we don't even really understand or know the full implications of what these changes are. But I think a big portion of it is going to be looking at data. Okay, so these kids that are getting overridden into detention, um, what is the makeup of these kids? Um, what do their Maisie screenings look like? The Maisie is the behavioral health screen intake. What do their game screenings look like? That's the mental health screening at detention. These kids that are getting mandatorily overridden into detention because of these changes in 2329, are these youth overwhelmingly being identified as having behavioral health, mental health concerns? If so, could we be doing more in the community to address these issues instead of these youth having to get pushed into the justice system further and being placed in detention? So that's where stepping up comes into the fray, because yeah, I would believe that there's a lot of kids that get pushed into our systems simply because of behavioral health and mental health concerns. I think when you start looking at the makeup uh, of the youth population in detention, over 80% of them are screening as having mental health needs. When you look at the population of kids at the juvenile correctional facility, it's over 75%. So it's hard to argue with the overwhelming majority of those numbers that we're seeing. So I don't know if any of that made sense, but those are my initial reactions to that.
Yeah, no, and thank you for that, Clay. And I know we're getting to time, so I just wanted to, follow that up by saying we are hoping that within local Stepping Up for Youth councils, that solutions and conversations and early intervention strategies can be thought on, decided upon, and strategized on so that folks can try to you know really have a positive impact on their systems. And so that's how it does complement, hopefully, any of the work that we're doing in our communities, is that coming together as a collaborative, we're trying to find those solutions as a unit together, so that we can start having a positive impact for the people that we serve. So thank you all so much for joining today. We really hope this was helpful and informative. We hope to get a ton of emails and forms completed with interest. And we are definitely here to answer any questions, provide any further presentations, and we look forward to working with you all in the future.
Thanks,
Thank you
everyone.
so much.